So we're now going to be moving into a new section where we're going to be talking more broadly about the digital tools that can be used in residential care. So the challenges with obtaining relevant information in the aged care journey are quite clear. How digital tools in aged care can actually support efficiency is what we're going to be talking about. And also, what is an electronic prescription for those who haven't heard about that yet, and an active script list, which is an extension of that conversation. And also talking about My Health app. So please stand by for a short video, which is taken from the perspective of a resident residing in a residential home, and it's entitled They Can Know Me Better from a Digital Record.
Digital health allows us to have timely access to specialists, to GPs, also to medication changes.
Being digitally enabled minimises the medical risks, but it also gives timely and high quality care because it's a quicker process.
One of the reasons digital health is so important in residents coming into care is there's a lot of pieces of information coming from a lot of places, and sometimes they're not always accurate.
Like, we don't really know their past medical history that really correctly, and we sometimes don't really know the exact medications they are taking.
We have to do a lot of detective work. There's no one source of truth that we can go to. It's often trying to gather information from multiple sources in multiple ways, which can really be time consuming. Not having that information is a real barrier to providing effective care.
So if we can get information digitally from My Health record, it's much easier for us to transition them in.
Having a single source of truth like My Health record is just so critical.
My mother-in-law only speaks Cantonese, and it is very, very important that they have access to her health record digitally, so that anyone who needs to look after her health know what to do, where to look for it, what she needs.
We can just pull up the record and know all the medical histories, which is important for us to provide the best care for them. My Health record is going to continue to enable us to provide the best health care for our residents. That is something that I look forward to in the near future.
With the help of e-prescribing, when I contact doctor to get something charted, it's quite easier. They can easily go into the name of the resident and can chart the medicine that they need.
E-prescriptions have improved the practicalities or the impracticalities of paperwork of the old scripts in terms of getting a piece of paper from one place to another, and that's been a big help, no doubt about that.
Digital health helped us to pack these medications in a very safe manner, and at the same time very accurate and efficient, so residents can get their medication on time.
Digital health is a real game changer for everyone who works in residential aged care facilities. For us, it gives us accuracy in administration, especially for medication need a precise timing.
The doctor is able to prescribe electronically from their phone or from the facility, and that electronic chart then translates straight through to the pharmacy and straight through to the facility. Being able to have those technologies in the store and being able to capitalise on them is priceless.
With the electronic scripts, we don't have to worry or think too hard about it.
係啊，我好喜歡現代科技㗎。我覺得佢哋喺個電子記錄裏邊咧，都能夠了解到我用乜嘢中藥或者藥油，咁對於我嘅健康咧更有幫助。
And the patient can upload the traditional medication they are taking onto their My Health record. From there, I can better give advice and give a better treatment based on what they're taking, what their beliefs are.
The global pandemic provided aged care with some additional challenges and risks. It also provided us with some great opportunities. So we were able to accelerate the use of telehealth and e-consultations.
For our residents like Philip, telehealth has been actually crucial for him to still have accessible access to his doctor. It puts all the clinicians on the same page, which allows us to treat and manage the complexity of our clients more effectively.
That is bloody great technology, isn't it? The neurologist said to me when I was talking to him, what medications are you on? And I said, I can't tell you. I don't know. Goodwin can instantly send him over the list and he knows exactly what I'm on, and he then takes that up with my GP. Digital health has allowed me to get the care I need without leaving my room.
I can't wait one day we can have one single system with my health record, with all the necessary information under one umbrella, accessible to everybody, to support us to provide the best care for our residents.
I'm really excited about a future where digital is not a new thing, it's just part of what we do, it's just part of healthcare.
My hope is that digital health will provide a better health outcome to all residents in aged care.
Digital healthcare should just be the way we do health. We do it in every aspect of our lives. Everyone has smartphones, everyone uses apps. So we need to move to a place where that's just part of how we run the health system, but it's connected and it's much easier for people to navigate and to get the care they need because everyone knows their care needs.
而家有一個電子記錄咧，可以好方便咁同我屋企裏面溝通，幾好。
Thanks, Jamie. Okay. Now we're going to be talking about our friend Caleb. He's going to be our patient. So during Caleb's healthcare journey, there were around 9 interactions where digital health has been used, and on each of these occasions, the digital information supported clinical decision-making. So let's look at some digital health tools and how they informed Caleb's healthcare journey. So Caleb Darrington, he's an 88-year-old male. Let's say he was living independently at home in the community until he had a fall. He was subsequently taken to hospital in an ambulance. Staff in the emergency department accessed Caleb's My Health record to gain an understanding of his overall health, and they would have done this via the hospital clinical information software. They ascertained that he had sustained a fractured neck of femur, and was required to have an arthroplasty. After a short stay in hospital, the family were consulted, and it was determined that Caleb was no longer going to be able to manage back in the community. So he was transferred then to an aged care home. Upon admission to the aged care home, the nurse assessed Caleb's My Health record via their clinical information software system and looked at the discharge summary from hospital, also looked at the medicines view and the shared health summary, which would have been done by the GP previously, and also looked at the immunisation record. The residential aged care home nurse arranged a telehealth consult for Caleb to see his regular community GP, and Caleb was pleased that he did not have to leave the residential home in order to do so. During this consult, Caleb's GP then sent a pathology e-request for HbA1c. They also prescribed some medicines and sent the prescription to Caleb's active script list. The pharmacist accessed Caleb's My Health record, reviewing his medical history and medicines information to gain an overall understanding of Caleb's health and medication status. He dispensed the medicines from Caleb's active script list, which was subsequently delivered to the residential aged care home. Caleb was able to view all the medicines that had been prescribed to him via his My Health app. So for someone that is living in the community, transitioning into the residential aged care setting, there are quite a number of digital tools that are utilised to be able to glean information about that particular individual and to keep that transaction of relevant pertinent, easily accessible information at the fingertips of all the healthcare providers that are actually providing care for Caleb. So during that healthcare journey scenario that I just shared for Caleb, I mentioned his active script list. So moving forward, as residents move from the community setting into residential, you'll find more and more people that will have an active script list in place, just like our friend Caleb. For those who are not yet across what an active script list is, I will explain. So what we know to be true, especially in the 70 plus age demographic, is that we have a situation where polypharmacy occurs, meaning multiple prescriptions are required. Now, historically, we had the paper-based system. Then we moved to electronic prescribing, meaning for every script written that you get a digital token sent to your phone. This is via SMS or via email. To address the situation where those with polypharmacy had multiple digital or electronic tokens being sent to them, they had to create a solution. It has been designed as a token management solution for electronic prescribing. And at this time, it is recommended to obtain one for a consumer or a patient. They have to actually liaise with their pharmacy, not their GP. So this is something that would need to be done ahead of time before entering residential. So to prepare yourself to ask the pharmacist about registering for an active script list, you actually have to have 100 points of ID, just like you do with any kind of scenario where you're getting something officially set up. So this could be in the forms of a driver's license, Medicare card, or passport, or any other relevant. That adds up to 100 points. So once registered, you will no longer need to keep track of your electronic prescription tokens sent to you by your GP. So having an active script list means you can walk into any participating pharmacy, give consent for staff to access your list, and have that pharmacy dispense your medicines, which is really good if you're still traveling around. So during your application, you can actually nominate a family member or a paid carer to be a responsible person to pick up your medications for you. So when you're completing the form, which I think was that one here. So this form on the right-hand side, one of the questions will be, please enter in the relevant details for the person that you also want to have pick up your medications from time to time. So once you've completed the application at the pharmacy, you will receive a digital notification relating to the consent to access. So these options might be click 1 for yes, I grant ongoing access. Click 2 for yes, I grant access for 1 day only, or click 3 for no, I do not want to grant access. So once you've granted access, all your existing prescriptions will then be pre-populated into the app. So we talked about the My Health app that our friend Caleb, along his healthcare journey, ending up in residential, that he had access to his app and he could actually have a look at all his medications and all his health information. So if you wish to obtain your My Health record via the app, it's as easy as downloading it. You just need to go to your app store. So depending on whether you're an Apple user or not, you would just go and download the app. So let's have a look here. He was able to, just going back to our friend Caleb, there's a few steps that he needed to follow to activate the active script list on his app. So once he's got an active script list with the pharmacist, he's gone to the App Store and downloaded the app, he can then link the ASL, the active script list, to his app, which means that every time the GP prescribes a medication, that it will actually be sent directly to the app. If he is using an app which is not the My Health record app, and they might have a pharmacy-based one, the same process is followed. So the script will automatically go to whichever one he nominates as the one that he wants it to be visible in. So all of the documentation that we outlined previously, that we've discussed, it'll all be accessible and visible via the app. So one of the new features that is also available via the app now is a find and book a health service. And caveat the health service has to actually be linked with the National Health Service directory for them to be visible, but this is a new feature that's just been introduced via the app as well. So you can navigate easily through all the relevant tiles within the My Health app to locate the information, whether it's allergies, medicines, scans, test results, or medical history. It's quite easy to navigate. And this is just a reiteration of adding the tokens as they come through your GP. It will just ask you to add the electronic prescription into your My Health app. If you've chosen not to get a My Health app and use the pharmacy-based one previously, it will give you the option to open it in the browser as opposed to in the app. That will allow you to utilise other applications.